everyone, this is Vishakha and I'm bringing to you again the new section of Let Us Explain. And in this Let Us Explain section, we explain a news to you from a holistic perspective, and that news which has a greater chance to be asked in any of your exams. So this section is brought to you by the acubeias, which help you prepare for the civil services in a very unique and a very simple way. So let's go ahead. Now about the news, today's news is mucormycosis, commonly called as a black fungal disease. Now this has been in news for several reasons. Now we are going to discuss why it was in news, what it is, what are the different kind of mucormycosis, and what is that you should do about it. So beginning with that is the first question is, what is mucormycosis? Mucormycosis is also called black fungus, or zygomycosis is a serious but a rare fungal infection caused by the group of molds called the mucormycetes. Mucormycetes are nothing. It's a group of fungi that are present in your environment and particularly in soil. So this is a fungi only. It looks like this, a very common fungi, but it can cause a very deadly disease. It can cause black lesions and everything, but common symptoms can be blackhead and etc., which we'll see later. Now the types of mucormycosis is since I said it can cause lesions as well as at the same time it can only cause you headache and very common symptoms which seems like a common cold etc. This depends on the type of mucormycosis. That means the type of fungal disease that black fungus that has impacted you. So there are mainly 5 types of mucormycosis. One is rhinocerebral. Rhinocerebral, as the name suggests, it impacts your brain. So it impacts sinuses that spread to brain, and it is most commonly found in people who have uncontrolled diabetes or kidney. Next is the pulmonary or lung mucormycosis. You can see in the name that this impacts your lung, but it is more common found in people who had cancer or a recent organ transplant. These are more susceptible to this lung mucormycosis. Next is gastrointestinal mucormycosis. This often impacts young children than adults, and usually its victims are premature or low birth weight in infants. Next is skin or cutaneous mucormycosis. This is called skin mucormycosis because it enters the skin through a break in your skin, either by surgery or something like that, which weakens your immune system. And next in the series is disseminated mucormycosis. That means infection that spread in your body through bloodstream, mostly of which affect your brain. So it impacts brain only, but this is disseminated through bloodstream, and that's why it is called a disseminated mucormycosis. After seeing the transmission, it is important to understand, after seeing the types of mucormycosis, it is important to see how it is transmitted, because in order to understand any disease, prevention and cure, you need to understand what is its origin, how it is transmitted. So we'll see here the transmission part. The transmission part, it says that it occurs through inhalation of the spores from environment. So generally it is found in soil, it can be even found in air or somewhere. So if you infest the if you inject spores, then it can move to your body. But one thing should be taken care of here, that it does not communicate from people to people or people to animal. That is one thing that you should take care of, that not people to people or people to animal. And usually it occurs in people who have existing comorbidity or any health problem with a lower immunity. So just remember this. Usually weak immunity is cause for this, and it is happening in COVID patient because of the weakened immunity. We'll see that in detail, that why it is related to COVID. Now moving ahead is, and often it develops on the wet surface, not just COVID, but any person who has lesser community can be infected with this. Next is, what are its symptoms? Because we have so far we have known that mucormycosis shows various kinds of symptoms. In terms of, some people develop lesions, for some people it is simple headache, and for some people it is gastrointestinal disorders. So it's important to first see its symptoms. So symptoms of black fungus include getting infected by inhaled fungal spores from the air, they have sinuses or lung issues. These are common symptoms. Other symptoms include pain or redness around the eyes or nose, fever, headache, shortness of breath, bloody vomit, abdominal pain, etc. Or it can be even one-sided facial swelling, numbness, black lesion in altered mental status. So these are certain symptoms of black fungus disease. Of this, The initial symptoms are like symptoms that you can bear, but development of swelling, numbness, and black lesions, it's a very severe stage. That is something a person should not reach, and early recognition is very important. For that reason, symptoms should be taken care of. Now, what is the relationship with the COVID? We are reading this news somewhere, and the entire black fungus disease became a news during COVID. So there was a correlation which was seen by doctors and international institution. The relationship was like COVID patients are more vulnerable to black fungus disease. And why that is so? It's a scenario that you can understand is that the patient who have high risk of diabetes. Now that person, when contract COVID, they're treated with steroids. Steroid, what they do is they compromise your immunity. And once your immunity is compromised, you become a house bed for black fungus disease. So this is the correlation that doctors have identified. That while steroids help in reducing the inflammation in lungs, they decreases the immunity. So not only the diabetic patient, even non-diabetic patient becomes susceptible to black fungal disease. So this is the correlation for the reason that black fungus disease has becomes a big deal these days. Now, how it is diagnosed? For diagnosis, healthcare provider generally they see your medical history, they'll see symptoms, they physically examine, but even that is not sufficient. In order to conclude, they will do the biopsy of the body fluid. They can also take the help of CT scan or MRI. And this is done because many symptoms of COVID or black fungus are same. That's why CT or MRI scan is preferred, because as we saw, the symptoms are headache, fever, etc. So many of the fevers are similar to COVID. So in order to conclusively conclude, it is important that these diagnoses are conducted. Now, the next question is, how can we prevent this? In order to prevent this, it's important first to see the treatment. Both prevention and treatment we are going to take care of. Treatment that mucormycosis is treated with antifungal medicines like amphotericin B, etc. This you may see in the today's current affair news. It was in news because Delhi High Court asked the central and state government that why there is a shortage of the medicine used to treat the black fungus disease, and we'll cover that in current affairs session. But yes, this is the medicine that is being used, that is an antifungal medicine. Again, not just this, they maintain a sufficient hydration by IV saline system. Eventually, if these initial medications are not able to prevent that, then surgery is also prescribed to remove the infected part. But like it is said, prevention is better than cure, because sometimes treatment may lead to a patient losing their limbs. Sometimes it is eye, sometimes it is a hand, or sometimes it is some other part of the body. So it is very important that you recognize it at initial stage and take the required preventive steps. So what is prevention? Like it is said, prevention is better than cure. Preventive steps doctor advise to control diabetes and reduce the use of steroids. If you are having the symptoms of diabetes, try to control it on time. Also, try to minimize as much as possible use of steroid. Discontinue immunodulating drugs, that is those immunosuppressant, because it may be helping you reduce the other symptoms, but you may become susceptible to black fungal disease. Also, doctor advised to monitor the blood glucose level of the patient who have recently recovered from the corona. And even before that, this is like the later stage. In initial stage, it is important for people to use mask if they are in vicinity of the dusty construction site, to wear long sleeved shirt, shoes if you are moving around soil or mossy areas, to avoid contact with the water damaged building, especially during disaster, which is very important in Kerala, Karnataka, and Gujarat and Maharashtra right now, which is suffering from the cyclone these days. On the similar level, even the government has come up with advisory. So these are the preventive steps that is supposed to be taken by everybody in the country. So this was it. This was me explaining mucormycosis black fungal disease. Thank you so much. Thank you for staying with me. Now stay at home, stay healthy, and stay safe. And stay connected to acubeias, because we provide you content in a very unique and very simpler manner.